Bismillahirrahmanirrahim. Welcome, guys. Today we will discuss about the audit cycle, whether it comes in your exam station or you have to do this in your residency program. Many students find it very challenging and difficult to conduct an audit. But by the end of this video, you will be able to conduct and do the audit cycle easily, whether it's in your exam or in your training program. As we all know that the CPSC has made mandatory one of the exam station for the talks is for the research project or the clinical audit. So you all need to know about the audit and the research. So let's talk about the audit. Please remember that if you focus on the key concept of the audit cycle, you will be able to do any of the scenario or any of the audit on any topic. So what is an audit? It is an evaluation of an ongoing system that improves the quality of care using the systematic approach, and it is done by any organization. In the medical practice, audit is done by either the hospital administration or the doctor and against the present standards, whether we are meeting the global standards or not. Its aim is to review on the current practice, assess the competencies and compliance, and identify the gaps and loopholes. So, how to conduct an audit cycle? Please memorize all these 6 steps. They are must. Number one is to select a topic. Second is to set the standards. Third is the data collection. Fourth is the data analysis. Fifth is recommendations and implementations. Sixth, and the last step, but the foremost step is to re-audit. In the exam, usually students forget to mention the re-audit. Please do not forget this step. Let's explain all the steps of the audit cycle step by step. The first step is to select a topic. Whether you are a medical resident doing an audit cycle for your research purpose or for your exam purpose, you need to select a topic as a first step of the audit cycle. It can be anything. It can be any problem that is occurring in the health setting and is not meeting any global standards. So, how to select a topic? First thing is read the scenario carefully in your exam, or if you are conducting an audit cycle for your training program, just think about the different procedures that is not meeting the global standards. It should be precise. Select the topic on the particular procedure or the outcome. For instance, in the Ghanaian of the outcome, fetal-maternal outcome, or the any management style, for example, different types of hysterectomies, elective versus emergency. And after that, take a ethical approval by making a synopsis of that particular topic. So these are the steps you need to cover for the or to start the audit cycle. If in the exam you just got confused the how to make a topic and how to select a topic from that particular scenario, just please easily do that. Start with an audit, the word audit, and then audit on this. So this is the easiest step on how to select a topic. Second step is to set the standards. You should know that the different guidelines are for the different topics. Please do not confuse the NICE with the RCOG. It will lead to reduction of your mark. SOGP guidelines are for the diabetes and the blood transfusion. The diabetes and hypertension in the pregnancy are for the by the NICE guidelines. RCOG guidelines includes VBAC, HOPS coli, and the bleeding disorders. American College of Gynecology of guidelines are for the fetal growth restriction of the SGA, Society of Gynecology of Canada, and the cancers and the same guidelines are from by the FIGO and the WHO. So please, you should know that which guidelines belongs to which topic. Please do not confuse, otherwise it will lead to detection of your mark. Then comes the data collection. First thing is make a performer and either it can be a pre-designed or pre-tested. Collect the data. The data collection are of the two types, primary data collection and secondary data. The primary data is from the patient and the healthcare professional, the doctor and the staff directly. However, the secondary data is from the hospital records and the file. It can be any prospective data collection or the retrospective, depending upon the type of audit you are conducting. So you can easily say that I will make a pre-designed performer and collect the primary data from the patient retrospectively or prospectively. The prospective data is mainly from the patients and the healthcare workers. So this is the easiest step if you follow. You can easily do the step 3 of the audit cycle. Then comes the data analysis. I will analyze the data using the different softwares like SPSS with the help of different variables. These are qualitative and quantitative and dependent and independent variables, and analyze my results and tell about the stats of my ward in the form of a tabulation or the bar chart or pie chart. So you can easily say these things and the lines. So in your fourth step, which is the data analysis, and you can make if there's any problem and you need to find out the determinants of that problem, then just they say that I will tabulate the determinants of that problem with respect to the frequency and the percentages of that problem. So this is how you will analyze your results. Then comes the recommendations and the implementations. So the first thing is to how you will recommend and then to implement these findings. Just say that I will conduct a meeting with my staff, can make the recommendations with the help of hospital authority or the departmental board meeting. The recommendations on the specific topics are as follows. After telling about the recommendation, we can implement these changes with the help of my team, including medics and the paramedic staff, after making the local protocols under the supervision of head of the department of a XYZ hospital for a specific time period, and then I will reconduct or re-audit. So these are, I will let you know about the general recommendations and the action plan. If you incorporate these general recommendations in any of your audit cycle or any of your scenario, you can easily do the recommendation step. So I can make we can use drills. We can have the training of the PGRs, residents, doctors, staff. We can have a teaching session of our doctors for that particular problem. We will ensure the availability of the equipment and the logistics, make a local protocol according to that particular problem. There must be the proper documentation of that procedure or of that particular outcome management of problem. There must be the proper supervision of that problem. Any trainee should do that particular procedure under supervision. Then comes the proper assessment and the staff collaboration. I will make sure and ensure that both medic and the paramedic staff are in collaboration, and then we will proceed towards that but to meet the global standards. I will ensure and check for the compliance with the help of either the regular structured feedback or and again doing the research or the audit cycle. So these are the general recommendations and action. If you follow these and inculcate these into any of your station or scenario of the audit, you can easily get marks. At the end, the the last step is to re-audit. Now, after implementing few changes, I shall re-audit to check whether we have met the global standards or not. So this is how you will end your audit cycle. In the exam, and if you tell about the 6 steps of the audit cycle without explaining and incorporating any of your scenarios, then you will just gain the 3 marks out of that, and which is not a passing marks. However, if you follow all these steps which I have told you, you can easily pass that particular station, or you can easily enable to do the particular audit on any specific topic in your presidency program. Let's do a practice. Example number 1. You are a hospital deputy administrator working with the WHO in XYZ hospital. You are worried about increasing numbers of cesarean infection, which is 30% in your gynae department. As you need to give the feedback to WHO, what will you do to overcome this? In this scenario, you are not asked about to do the audit cycle directly. This is an indirect example of the audit. So by reading this scenario, obviously, if you are comparing with the standards, you need to do the audit. So you should know that this session is about audit cycle. And how you will do that? Easily, you will first of all select a topic. So with the help of this scenario, how can you select a topic? It's very easy. Start with the word audit. Audit on increasing number of cesarean section in gynae department of XYZ hospital during 2023 to 2024. Make a time period, tell the department and do the audit. So it is a very easy to select a topic. Then comes the standard. You should know that the cesarean section guidelines are of the NICE guide by the NICE guidelines. The VBAC guidelines are by RCG. The Robson classification includes the 10 determinants of 10 types of cesarean section. And then comes the WHO criteria of cesarean section, which should not be increased from 20 to 15% worldwide. So you should know each and every step of these and set a standard. Then collect the data. Since we are doing the retrospective data collection, we will say, and we will do it from the secondary data that is from the hospital record. So I can say that I will collect the data by pre-design or pre-tested performer retrospectively with the help of a secondary data collection from the hospital records and the file. Then comes the data analysis. I will analyze the data with the help of the software SPSS 20, SPSS 24 or 26, which is the latest version you want to use. And then say that I will check or I will tabulate all the determinants with respect to the frequency and percentage of that determinant and and compile my result. So talk about the implementation and the changes. Let's incorporate all these recommendations here. So how to lessen the increased rate of cesarean section? I will make sure I will train my residents with the help of the drills on how to perform a normal delivery versus on how to perform a cesarean section. I will do the training of the residents on how to proceed or do any of the particular procedure. There must be the teaching sessions on the CTG, on the steps of cesarean section, on the steps of normal delivery. I will ensure the availability of the equipment present to do the conservative management if in the case of fetal distress before proceeding towards the emergency cesarean section, which is the one of the cause of emergency cesarean section. I will make a local protocol and make sure should be followed in the labor room. Before doing any of the cesarean section, especially emergency one, I will make sure that there will be the proper documentation of the cesarean section. For instance, if the cesarean section is for the due to the fetal distress, I will make sure that the CTGs, the pathological and the suspicious CTGs are attached, should be attached in the patient's record or file. The cesarean section must be done under the supervision of the senior most person, resident or a batch leader, and after informing the consultant on call. This should be the step I want to, and by the help of this, I will lessen the cesarean section rate. The senior most resident will do the proper assessment of the patient before proceeding towards the emergency cesarean section, either the vitals of the patient, the examination finding, the per vital examination, the CTG. The overall picture must be assessed. Then comes the staff collaboration. With the help of my nurses, my medics, paramedic staff, we will make our drills and trainings on how to do the duty in the labor room, and then we will implement these changes. I will ensure the compliance either by taking the proper feedbacks, by the morning meetings, or by the conducting the research on again the audit or the re-audit. So this is how you will be able to do this example very, very easily. So I hope now the audit cycle is not a difficult station or challenging one for you. This is another example. You should do it your own, and we will discuss this example in the next interactive session. What you need is to practice, as the practice makes a man perfect. So I hope with the end of this audit cycle video, you will be able to do the audit easily. Good luck and thank you.